This is a 22-year-old with multiple shoulder dislocations. We're going to do a Bankart repair. So here is the tear in the front of the shoulder. So for this procedure, we need two cannulas, one to hold the sutures and one to do our work. So we're going to put another cannula in up above this one. There should be ligament attached to the edge right here, but instead it's just bare. And so what we're going to have to do is grab the ligament and bring it up there. So we're just elevating the ligament off of the front because the ligament's actually pulled away from here and it's healed back down here. And that's what's created this big pocket for the shoulder to dislocate into. So we just need to free it up and get it out of this basically scar where it's healed so that we can mobilize it. In other words, bring it up to the torn edge where it belongs. And that's what we're doing with this instrument, is just removing it from the scar where it's been scarred down. So now what I'm going to be able to do is take a grasper and grab the ligament and pull it back up into place where it belongs. That's what it should look like. That should go right there. And so we mobilize this so we can put it back where it belongs, right there. So this belongs here, and that's what we're going to do next. So we've got one anchor in now, so that tendon is nice and tight back up against there. Remember how there's a big hole there, and now there's not. We're going to put one more anchor in. Pull one of these stitches out, the one closer to the tissue. And then the same thing, this we'll use to pass the suture through the tissue or through the tendon. Take a little bite of that. Rotate it around. So now we've got that around the tissue we want to repair. Tie the knot outside the body. So now we have a nice tight repair there. There's a bumper in the front to prevent the shoulder from dislocating, but more importantly than that, we've eliminated this big open space in the front and repaired the ligament back where it belongs. And that's it.